This lecture will cover the basics of doing structural therapy with couples. In this lecture, I will briefly review some basic structural concepts, discuss couple functioning and dysfunctioning within the theory, address the assumptions of the theory, talk about the role of the therapist and the process of therapy, and briefly touch on empirical support for this model, as well as applicability to different couples. Important structural therapy concepts include subsystems, boundaries, circular causality, and adaptability. Subsystems and boundaries, with the addition of hierarchy, form what Minuchin called the structure of the family. It was how we understand the shape of a system and all of its subsystems. Each subsystem is surrounded by a boundary that separates it from other subsystems, from the rest of the world, from its environment. And those boundaries can range from diffuse to rigid. Diffuse boundaries are not strong boundaries. They do not serve their purpose of differentiating one subsystem from another, and therefore there's an overflow of information that passes between those two subsystems, and also sometimes an overflow of functioning, which actually depletes the resources of the entire family or the entire system. And we often call those subsystems enmeshed when there are diffuse boundaries between them. Rigid boundaries, on the other hand, do not allow for the passing of information between two subsystems, between the family and its environment, do not allow for the sharing of resources across boundaries, which also depletes the functioning and the adaptability of the subsystem as well as the entire system. Structural family therapy is based in a notion of circular causality, and that is that there is no one cause for any problem. The family is stuck in a circular pattern where one behavior causes another behavior, which causes another behavior, and wherever we start or end the cycle is arbitrary and not the true cause of the problem. Your role as a therapist is to figure out everyone's role in this circle so that no one is left without any responsibility in maintaining the problem. The definition of a healthy family is one that can adapt to changes in its environment or be agents of change in its environment. As mentioned in the discussion of boundaries and subsystems, this requires a healthy boundary that permits exchange of information with the environment, but does not allow the family to bleed into the environment. So regulating the information flow in a healthy way. Similarly, couple functioning then is defined as a couple that is surrounded by a boundary that sufficiently separates them from their environment, but is permeable enough that they can exchange adaptively with the environment. So couples can interact with their environment without being totally closed off, shut down from influence or exchange with the environment, as well as not being so open that they don't have their own distinct identity as a couple. In the Gurman chapter on structural couple therapy, they also discuss this concept of internal differentiation, which is not to be confused with Bowen's differentiation. This is really about the differences between two partners. How do they view their differences? Because two people will always be different. And are these differences seen as resources or as threats? So functional couples will not only tolerate the differences between them, but actively encourage them. So if this is functioning, what does dysfunctioning look like? Minuchin described 3 patterns of couple dysfunctioning that center around a diffuse boundary around the couple or the parent subsystem. In the first example, there's almost no overt conflict between the couple. Rather, the couple is disengaged, rarely fights with one another, rarely spends any energy on their relationship. Rather, the energy is put into parenting, most likely, but could also be put into work or other areas of focus, hobbies. They're just parenting. They're possibly parenting ineffectively based on the assumptions of structural therapy because the subsystem does not have a good boundary. These are not necessarily families that will be in crisis, but rather can persist this way for long periods of time. In the second example, there is conflict. The diffuse boundary around the couple subsystem draws other people into coalitions, who then war against the other partner. This can be a child who's drawn into a stable alliance with one parent. This can also be family of origin members, friends, and this would be the kind of pattern that would typically lead to an affair. The third kind of diffuse boundary around the couple leads to detouring. So the couple agrees to focus on something other than their relationship, to worry about, to fight about, but the problem is never seen as within the relationship, is seen as existing in this third entity. And this is often when we might see children with more significant symptoms that come in. Now, these three patterns of dysfunction all have diffuse boundaries, which may lead you to think, well, what if there's a rigid boundary around the couple? Isn't that a problem as well? Yes, a rigid boundary around the couple can lead to emotional overload because the couple is contained within itself. There's no meaningful interaction with subsystems, with people outside of the couple. However, this type of couple may not present for therapy since they are a more closed system and are not open to interacting with their environment. But if they do, they may be hyper-focused or hyper-vigilant on one another, averse to conflict, or highly conflictual due to their enmeshment. Couples with unhealthy boundaries around their subsystem are more likely to experience issues during normative life cycle changes, so the birth of a child, the death of a parent, the launching of a child, and non-normative stressors. There are two important assumptions in structural therapy that are important for our knowledge of couples therapy. The first is that we assume competence. We assume that our clients are competent, that couples are competent. This is a non-deterministic view, meaning that this couple wasn't doomed. They're not walking the path they were always supposed to walk. Rather, this structure evolves based on an infinite number of factors and events, and that this couple does possess adaptive resources that simply aren't being used yet, or aren't being used currently. Maybe they were being used in the past, hence why we always ask when things started and if things were ever different or if other solutions have worked. No matter how dysfunctional the structure of a couple seems at the beginning of treatment, we never assume that this structure reveals some essential core quality of the couple. So we don't doom a couple to failure, even if the structure seems quite dysfunctional. We assume that they do possess other behaviors and other resources that we can help them tap into. Now, we do this by assuming also that each couple is unique, that couples may resist our reframes and our interventions, but that this is not an essential flaw of the couple or of the therapist, but that every intervention is a tentative probe, provides feedback on that particular couple's uniqueness, and that teaches us about their resources and about what adaptive behaviors and patterns they might have. So we don't think about different interventions as succeeding or failing because we learn from all of them. So the mechanism of change in structural couples therapy is the production of new relational experiences. So couples have been relating to one another in the same way for quite a long period of time. They're stuck in that pattern, and it's not providing them solutions. So what our goal is to help them have new experiences with one another. And we typically do that through enactments. Now, enactments is not necessarily a discrete intervention or a rehearsed conversation. It's more of a style of doing therapy where the therapist directs the interactions between the clients. You may tell them to look one another in the eye, turn towards each other, give a different type of response. anything that is different from what you see them already doing. And the goal for this is that as a therapist, you can see how they interact and how they communicate with one another, and that gives you information for changing it. And then also, once you do change some of their behaviors, the clients can experience new ways of interacting with one another. In couples therapy, we most often have enactments where we have couples explore the differences between them. And this gives us a lot of information about the structure of the couple subsystem. Another important intervention is reframing. Reframes have two parts. One is where we validate the client's linear perception of the problem. And then the second part is where we introduce our systemic view of the problem. This does two things. One, it helps the couple feel heard, that you validate their perception of the problem, because their perception of the problem is not necessarily wrong. It's based in a lot of experience. It's based in popular and dominant discourses about relationships or mental health. But you also want to introduce your systemic view, because that's what you're going to be drawing on when you're conducting therapy. So this reframes introduce the couple to your systemic way of thinking, and in a sense, request from them informed consent for how you're going to conduct treatment. So they will often initially resist the reframe. They might not. Feeling like, no, that doesn't sound right. It really is one person's problem. It doesn't serve this systemic function that you're saying. But their resistance provides more material for us to develop hypotheses and understand what resources this couple has. When it comes to conflict, there are two different kinds of interventions in structural couple therapy. One is unbalancing and one is softening. And it depends on what type of conflict your couples are stuck in. So if your couple is conflict avoidant, so they actively avoid that there are differences and issues between them and refuse to engage in conflict, you can work to instigate a bit of conflict. Now, that doesn't mean you pick a fight, but it means you want to elicit an enactment where they have a more productive conflict experience. Typically, couples like this are afraid of conflict, afraid of what it might do. There's a lot of anxiety at the idea of conflict. But if you can get them to communicate in a slightly different way that brings some conflict to the forefront in a healthy, honest way, then that creates a new relational experience for them. And you do this by lending indignation to one partner. Now, typically you start with the partner who is already in the one down position, because the one up partner is already in the position to feel indignation. And so you may discuss with them through reframes ways that you hypothesize that they might feel or things they might do to get them to have a different kind of conversation. Now, of course, this requires some amount of balancing, because you don't want to ruin your alliance with the other partner. And often what happens is you spend some time unbalancing one partner first and then the next, so that they will continue to have honest and open conversations about their conflict instead of avoiding it. Softening is an intervention for high conflict couples where they're continually focused on their differences and can't seem to have productive conflict either. And so here, on the opposite side, the therapist lends vulnerability to one partner, softens them a bit, and imagines the vulnerable feelings that are under typically the more high conflict feelings. So typically these couples are going to be more hostile, angry, tense. And so you want to pull out some of those softer emotions, not necessarily because you want to explore those emotions like you would in EFT, but because bringing out those softer emotions is going to create a different relational experience between the partners. It should be clear by now that the role of the structural couple therapist is to produce change, or to help the couples produce change through new relational experiences. Your job is to seek out latent relational resources that they're not currently using by interrupting the circular interactions that are maintaining the problem. So you're observing these enactments, gathering information about their pattern and about their structure, and then applying it in a subsequent interaction. This requires some amount of balancing. You have to join with the clients enough that you can unbalance them, that they do trust you to instigate different conversations or conflicts, to challenge them. But you can't join so much that you can't challenge them. And you have to balance between each of the partners as well. The structure of therapy proceeds first with assessing the problem and the structure so that you can present a reframe. So you need to gather enough information in the first session to be able to hypothesize about the problem as the clients present it to you. How does their relational structure maintain this problem? And what might be some of the circular interactions that are maintaining the problem? So as you join with clients in a first session, you're getting a feel for how they interact with one another, and you can sort of adapt to it, adapt some mannerisms, and join with the structure just enough so that you can interrupt it, but not so much that you become organized by it. And then the session concludes with a reframe, a formulation of how the problem is maintained by the relational structure, so that the lack of intimacy between two partners maybe have something to do with the fact that they're not partners outside of being parents. And that would be an example of the first type of diffuse boundary that we talked about when we were talking about couple dysfunction. Now, of course, you would word it much more artfully than that, but the idea is that you take what the couples come in with and you acknowledge that that is the problem, and you give them a little taste for how you view the problem and how you think that you all might be able to work through the problem. Then you want to work on destabilizing the structure that they come in with. So you're going to elicit competencies from them. We assume competence in our clients. So you're looking for unused skills or behaviors within each partner. And we assume uniqueness, which means these are going to be trial and error enactments. You know, you may do some unbalancing, you may do some softening, and you may see some different interactions, but it may not stick. You know, the clients may not come back afterwards and say that they had, you know, a great week and they communicated differently, and you may feel as though this means that your intervention was a failure. But really, this is just the natural pattern of systems to maintain that homeostasis. Now, sometimes if you do start to achieve some progress in changing the old structure, crises can occur. And this is a natural mechanism of a system, of a relationship trying to maintain its current structure. And so instead of being shaken by that and falling into the client's frame and buying the client's linear frame, the important part here is to continue to validate their view of the problem, but encourage them to continue to communicate in the ways that they have been different for them. And then eventually the clients will start to display that new relational structure, that new way of communicating on their own. And your job is to applaud this metaphorically when you see it happening, to point out that they're speaking to one another differently, to find out more about when are things better, how do they know that things are better, how do they plan on continuing to relate to one another in this way. And then if the clients have been taking the initiative to maintain their new structure and their new pattern of communication, either they or you may suggest terminating, that it's appropriate to terminate. And now best practice here is to always leave the door open for clients and say that they can always come back if problems come back up. And this helps reduce some of the natural anxiety of ending therapy and having to sort of do it on your own. So structural therapy is an old model. It has been researched on its use with a diverse array of couples in terms of socioeconomic status, ethnicity, gender, variety of presenting problems. It can be used with new couples, long-term couples. It can be used for co-parenting therapy for couples who are separating and want to continue to parent well together. Of course, you have to assess appropriately for violence or threat of harm before doing couples therapy, particularly something like structural therapy, where you might actually be encouraging conflict at times. But we'll talk about this more in depth during the week that we cover intimate partner violence. But overall, there is an extensive research base on the efficacy of structural family therapy, and it does support that this is an effective therapy when used by a therapist who believes the assumptions and can take the role of a structural therapist well, and can be a great way for doing couples therapy. Thank you.